Welcome to this essential guide on understanding and managing menopause. As a woman or a healthcare professional, it's crucial to be informed about menopause. Today, we will explore the definition, etiology, risks, clinical features, investigations, and management of menopause. What is menopause? Menopause is a point in time when you've gone 12 consecutive months without a menstrual period. It happens, on average, at age 52. It's a natural process that occurs when your ovaries stop producing reproductive hormones. When menopause happens due to surgery or medical treatment, it's called induced menopause. Hormonal changes due to menopause can cause uncomfortable physical and emotional symptoms. There are treatments available to help with symptoms of menopause, like hormone therapy, medication, or lifestyle adjustments. What are the three stages of menopause? Perimenopause, or menopause transition. Perimenopause can begin 8 to 10 years before menopause when your ovaries gradually produce less and less estrogen. It usually starts when you're in your 40s. You can be in perimenopause for several months or several years. Many people begin feeling symptoms like irregular periods, hot flashes, and mood swings in perimenopause. Menopause. Menopause is the point when you no longer have menstrual periods. At this stage, your ovaries don't release eggs, and your body doesn't produce much estrogen. A healthcare provider diagnoses menopause when you've gone without a period for 12 consecutive months. Unlike the other stages, menopause itself is a defined moment, so you don't stay in this stage. Postmenopause. This is the time after menopause. You stay in postmenopause for the rest of your life. While most symptoms of menopause ease up in postmenopause, you can continue to have mild menopausal symptoms for several years in postmenopause. People in the postmenopausal phase are at an increased risk for osteoporosis and heart disease due to low estrogen levels. What is premature menopause? Menopause, when it occurs between the ages of 45 and 55, is considered natural and is a normal part of aging. Menopause that occurs before the age of 45 is called early menopause. Menopause that occurs at 40 or younger is considered premature menopause. When there's no medical or surgical cause for premature menopause, it's called primary ovarian insufficiency. What is the average age for menopause? The average age of menopause in the United States is 52 years old, but the transition to menopause usually begins in your mid-40s. How long does menopause last? Menopause is a point in time, so you don't stay in menopause. You reach it when you haven't gotten a menstrual period for 1 year. Immediately after you reach menopause, you move into postmenopause. This stage lasts for the rest of your life. Symptoms and causes. You may be transitioning into menopause if you begin experiencing some or all of the following symptoms: irregular periods or periods that are heavier or lighter than usual, hot flashes, also known as vasomotor symptoms, a sudden feeling of warmth that spreads over your body, night sweats and/or cold flashes, vaginal dryness that causes discomfort during sex, urinary urgency, a pressing need to pee more frequently, difficulty sleeping, insomnia, emotional changes, irritability, mood swings or depression, dry skin, dry eyes or dry mouth, worsening premenstrual syndrome, PMS, breast tenderness. Some people might also experience racing heart, headaches, joint and muscle aches and pains, changes in libido, sex drive, difficulty concentrating, or memory lapses, often temporary, weight gain, hair loss, or thinning. Changes in your hormone levels cause these symptoms. Some people have intense symptoms of menopause, while others have mild symptoms. Not everyone will have the same symptoms as they transition to menopause. Contact a healthcare provider if you're unsure if your symptoms are related to menopause or another health condition. How long do you have symptoms of menopause? You can have symptoms of menopause for up to 10 years before it officially occurs. The average length of menopause symptoms is about 7 years. Most people say their symptoms ease up or disappear completely once they reach postmenopause. Why does menopause happen? When menopause happens on its own, natural menopause, it's a normal part of aging. Menopause is defined as a complete year without menstrual bleeding, in the absence of any surgery or medical condition that may cause bleeding to stop, such as hormonal birth control, chemotherapy, or radiation therapy. Surgical removal of your ovaries will result in menopause if your surgeon removes both ovaries. As you age, Your reproductive cycle begins to slow down and prepares to stop. This cycle has been continuously functioning since puberty. As menopause nears, your ovaries make less estrogen. When this decrease occurs, your menstrual cycle, period, starts to change. It can become irregular and then stop. Physical changes can also happen as your body adapts to different hormone levels. The symptoms you experience during each stage of menopause are all part of your body's adjustment to these changes. Diagnosis and tests. How is menopause diagnosed? The first is, if you've gone a full year, 12 straight months, without a period, you've entered menopause and are postmenopausal. Blood tests that check certain hormone levels can suggest that you've reached menopause. Usually, though, blood work isn't necessary. In some situations, blood tests can be misleading because so many hormonal fluctuations occur during the perimenopause stage. What are the health risks of menopause? Osteoporosis. Osteoporosis occurs when the insides of your bones become less dense, making them more fragile and likely to fracture. Estrogen plays an important role in preserving bone mass. Estrogen signals cells in the bones to stop breaking down. People lose an average of 25% of their bone mass from the time of menopause to age 60. This is largely because of the loss of estrogen. Your healthcare provider may want to test the strength of your bones over time. Bone mineral density testing, also called bone densitometry, is a quick way to see how much calcium you have in certain parts of your bones. Cardiovascular diseases. After menopause, your risk for cardiovascular disease tends to increase because of several things, including the loss of estrogen, increased blood pressure, certain lifestyle habits like smoking cigarettes, drinking alcohol, or eating unhealthy foods, if these habits apply to you. A decrease in physical activity, which can lead to high cholesterol and other conditions, depending on your activity levels after menopause. When should I see my healthcare provider? You should contact your provider as a precaution if you have any of the following symptoms. Your periods become much heavier than usual. You pass several large blood clots, larger than a quarter. You have your period for longer than 7 days. The length of time between your periods is less than 21 days. You skip periods before the age of 45. You bleed or spot between periods. You bleed after sex. Some common questions. Can I get pregnant during menopause? Yes. Until you know for sure that you've completed menopause, there's a chance of pregnancy. If you don't want to become pregnant, continue to use some form of birth control until you're sure you've gone through menopause. Can menopause affect sleep? Yes, you can experience trouble sleeping during menopause. This can be a normal side effect of menopause itself, or it could be due to another symptom of menopause. Hot flashes are a common culprit of sleepless nights during menopause. Can menopause affect my sex life? Yes, it can. Your declining hormone levels may affect how pleasurable sex is to you. Symptoms like vaginal dryness can make sex painful or uncomfortable. Not all people experience a decreased sexual desire. In some cases, it's just the opposite. Does menopause cause weight gain? It may. Hormone changes can impact your weight. For example, you may start to lose muscle as you get older, which can affect how your body gains weight. Are there any emotional changes that can happen during menopause? Menopause can cause a variety of emotional changes, including a lack of motivation and difficulty concentrating, anxiety, depression, mood changes and tension, aggressiveness and irritability. Treatments for menopause. Therapies that help to manage menopause symptoms include hormone therapy, HT. HT is done by taking the female hormones estrogen and progesterone during perimenopause and menopause. HT is most often prescribed in pill form, but estrogen can be given by using skin patches and vaginal creams. Talk with your healthcare provider about the risks and benefits of HT for you. Estrogen therapy, ET. ET is done by taking estrogen alone. ET is often prescribed for people who have had a hysterectomy. Estrogen is prescribed as pills, skin patches, and vaginal creams. Talk with your healthcare provider about the risks and benefits of ET for you. Non-hormonal treatment. This type of treatment is done with other types of medicines to relieve some of the symptoms of menopause. Estrogen alternatives. Estrogen alternatives are synthetic estrogens. One example is ospemifene. They improve symptoms of vaginal atrophy without affecting endometrial cancer risk. Alternative therapies. Homeopathy and herbal treatments are often called bioidentical hormones. They may offer some relief from some symptoms of menopause. But there are concerns about potency, safety, purity, and effectiveness. Thank you for joining us in this educational journey on understanding menopause. Stay informed and take proactive steps to safeguard your health.